Yeah, hello. My name's Steve Morris. I'm CEO of Arthritis SA, and today's World Arthritis Day. So I've got a guest today, Catherine Hill. Welcome, Catherine.
Yes, well, thank you for having me, Steve.
And amongst Catherine's role, she's the head of units in rheumatology at the Queen Elizabeth Hospital, and at the moment, president of the ARA.
Yep. So that's the Australian Rheumatology Association. So that's our professional body for not only rheumatologists but also health professionals who are interested or working in the rheumatology area, like physiotherapists, pharmacists, podiatrists, and importantly, rheumatology nurses.
Yeah, yeah. Thanks for that, Catherine. And just first question, I've got a few questions for you this morning. One is why do we need to have World Arthritis Day? Are the issues where people still don't recognise the impact of arthritis?
Yeah, I mean, I think it's really important because I think the we do totally underestimate the role of arthritis. I mean, I think if you talk to every person on the street, they'd always know someone who's got some form of arthritis, but we tend to overlook it when other things like cardiac disease and cancer, seem more important. But the impact of arthritis in many Australians' day-to-day lives is quite severe.
Yeah, no, thanks for that. Look, and are there any common myths that you'd like to address in relation to arthritis?
Well, I think the main common myth I'd like to say is that it's just a normal part of aging, and it's not. Um, and also that there's nothing we can do about arthritis. And I think both of those things are really incorrect. And there's certainly many Australians who live with arthritis. In fact, you've got 1 in 4 South Australians on your banner there that live with arthritis. But in many cases, we can do so much more than we're doing now. With inflammatory arthritis, such as rheumatoid arthritis or psoriatic arthritis or ankylosing spondylitis, we've got so many new therapies, and that's really changed the lives of many people, reduced the number of deformities that they have in their joints, the number of joint replacements they've had. So those new medications and new approaches to therapy have made massive change. But coming through, we've also got some new treatments also for some of the connective tissue diseases like lupus and scleroderma. And then we've also really working hard to make some changes in the osteoarthritis space with some studies. But also we know how much the what we call the non-pharmacological interventions can help. So we're talking about things like exercise, hydrotherapy, like you have arthritis, SA, the role of a dietitian, and there's and some analgesics can really improve people's quality of life.
Yeah, no, thanks for that, Catherine. And what obviously you see many issues in your day-to-day work, but what do you think are the biggest issues facing arthritis patients?
I think it's acknowledgement that they have a condition that impacts their lives that can be treated. So I see patients who are coming in for clinical studies, particularly related to osteoarthritis, and so often they haven't brought it up to their GP, or they are worried that there won't be anything that can be done, and so they haven't asked for help, or perhaps they haven't seen a physiotherapist or an exercise physiologist, where some of those things could make a really big difference to the pain and that they're having with their arthritis.
Yeah, so acknowledgement is a key issue then.
Yeah, yeah, and obviously we would like better access to care, and I think Arthritis SA is doing a great job in helping people with arthritis to find out about what's available in their local area, and give them help them with finding the right treatment for them.
Yeah, and just leading on from that, Catherine, there's a lot of talk, I suppose, in the health system about mental health issues. Are there any specific issues in terms of arthritis and mental health that you observe in your practice?
Mm. Well, the government does a survey, and it's by the Australian Institute of Health and Welfare, the AIHW, and they did a survey which they published last year that showed that not only did 1 in 4 Australians have arthritis, but about 1 in 5 of those were experienced very high levels of psychological distress. And so I think we need to acknowledge that and work hand in hand with not only physical side of arthritis, but also the psychological side of it as well.
Yeah. Look, you can't have any kind of conversation in health at the moment without talking about COVID in some form or other. So, have you seen any specific impacts of COVID on the health of arthritis patients?
Well, we've had a couple of impacts. Obviously, for our patients who are on immunosuppression, so drugs that depress their immune system to treat their arthritis, they've obviously been really concerned about their risk of COVID. It doesn't seem that they have an increased risk of getting COVID, and for most of the drugs, medications that they use for arthritis, it doesn't actually have an impact. In fact, some of the medications we use for arthritis, particularly inflammatory arthritis, such as rheumatoid arthritis, are actually used for severe COVID. And so that's had the knock-on effect that we have had a drug called tocilizumab, which is used for rheumatoid arthritis, but is in global short supply because of the pandemic. So that's unfortunately impacted some patients, but we've been working really hard with the Therapeutic Goods Administration and the drug manufacturer to reduce the impact on patients.
Yeah. In another sense, obviously, also within the COVID period, we've seen the evolution of telehealth. Have you
Mm.
seen any benefit from the evolution of that service in terms of access for arthritis patients?
Yeah, I mean, I think that for particularly rural and regional patients, and for some patients who are less mobile, telehealth has been a really important side of it. We've been mainly using phone here in South Australia, but some people are starting to use video calls, and I think that's going to be a really big evolution. We do acknowledge that we did a survey of patients in our Central Adelaide Local Health Network and found 80% of people were really happy with a telehealth service, but they just wanted to be able to know that they could come and see us face to face if they needed to. And some people do have problems with access to the internet. So video telehealth will be great for some patients and
Yeah,
for others not. But I
yeah,
think it's an extra service we can offer, and I think that's been really positive to see how that's really stepped up during the pandemic.
yeah, that's good. And look, given it is World Arthritis Day, what is the one piece of advice you want to give patients?
That there's always something we can do for your arthritis, and don't ignore it. Seek help.
All right. Thank you very much, Catherine. Thank you for your time.
Okay.